with the same page number and chapter name, etc. And even if you're discussing on certain topic, just help them with the page number in the chat box. Okay, so nutritional and food requirements of the elderly. So, is aging a disease? You can answer it in the chat box. Is aging a disease? No, aging is just a biological process. Okay, when does aging start? When does aging start in a person's life? Aging starts from the conception, okay, even before birth. From the time you are conceived in the female reproductive system, your cells divide, your organs form. From the fetal life itself, okay, aging has started. And when will it end? Where will the aging end? When will the aging end? The aging will end at death. Okay, so from conception to death, from the time a person is conceived in the female reproductive system till death, okay, we all go through the process of aging. So it is not a disease. Aging, getting old is not a disease, it's just a biological process. Okay, aging is associated with the changes in dynamic biological, physiological, environmental, psychological, behavioral, and social process. Okay, the way how you interact with yourself within the internal environment, the external environment, okay, at the various phases of your life is completely different. Okay, when you're young, your metabolism is quite high. As you get old, it reduces. Okay, physiological changes, when you're a child, your immunity is weakened by certain factors. You grow into an adult, you can cope up with certain disease. You grow old, again your immunity comes down. Okay, so this is how various factors, internal factors, external factors, internal environment, your physiological built up, your external environment, everything affects the aging process. And different part of the life, it reacts differently. Okay, all these processes which we have mentioned here, biological, physiological, environmental, psychological, behavior, etc. At the biological level, aging results from the impact of accumulation of a wide variety of molecular and cellular damage over time. Aging is nothing but the result of, we all know about free radicals, okay? How oxidative stress affects our health. Okay, so over the year, day by day, your body accumulates certain degree of oxidative stress. Even if you're having a diet which is quite good in antioxidants, doesn't mean that you are free from oxidative stress. Okay, at molecular level, oxidative stress does take place in the body, because that is how it should be. Okay, so over a period of time, our body, our muscles, each and every cell in our body accumulates these oxidative stress, and that is what we see outside as the signs and symptoms of aging. Okay, from a molecular level to the physiological effects. Okay, so basically, from the science terminology, it's aging is just the result of various cellular damage due to oxidative stress which we have accumulated over a period of time. So that's what leads to aging. Okay, so changes in which is influenced by the nutritional requirement when person gets old. So that's a good table, which is 10.1 table, 10.1, from page number 184 to 185. Okay, in this edition which I have, it's on 184 to 185. Beautifully they have represented different areas which gets influenced, physiological areas, which gets influenced because of certain nutritional requirement. Okay, especially in elderly. So first is the taste and smell. Okay, you can reply in the chat box. What do you think will be the effect of taste and smell as one gets older and older? In elderly, remember, we are talking about people who have crossed the age of 60. Okay, in textbook we are talking about the entire population who are above the age of 60. So when I ask you certain questions about what do you think will be the reaction of an elderly, imagine someone who is above 60 and above, okay, and how their body will um, react to these factors. Okay, so yeah, taste and smell over a period of time, it diminishes. Okay, even if you are making a good quality, a good, very good tasty food for them, they will not perceive the taste as how a young adult would perceive. Okay, so for example, the loss of ability to detect salt, sweet, okay, and even if they are hypertensive, you give them salt restricted diet, okay, they find it very unpalatable. Okay, so that is one thing to be taken care of. And why taste decreases over the period of time? Because you have taste buds on your tongue. Okay, it gradually, the count and the uh, receptor availability of the taste buds decreases over a period of time. Okay, the count as well as your taste buds undergo certain atrophy. Okay, it decreases in size, and its function also decreases, and into certain level its count will also, the number of taste buds which you have on your tongue, that will also decrease. So that is why over a period of time, when you grow old, your sense of taste and smell decreases. Then salivary glands, the production of saliva also reduces, because there is another thing called dehydration. Okay, which we'll discuss later, how dehydration affects the elderly and why they are prone to dehydration. That is one of the reason. And also at glandular level, your salivary glands have glandular tissues. Okay, even that undergoes atrophy. Okay, decreases in size, and its function also gets reduced. That is why there is a reduced secretion of saliva as one gets older. So their mouth is more prone to dryness and other kind of bacterial infections. So that is why we always mention that when you're preparing food for an elderly, would you prefer soft food, or would you prepare solid food, solid hard to chew food? What kind of food you will give to someone who is elderly in your family? Okay, it should be soft and easily digestible food. Okay, that is why, because their salivary glands are under functioning as a process of, as an aging process. Okay, then you have gastric function, same as in the case of salivary glands. The gastric juices, the secretion of gastric juices decreases over a period of time as you grow old. Okay, so that has to be taken care of. Teeth also, lots of elderly will resort to use of dentures. Okay, falling of the teeth because of reduced calcium and vitamin D in their diet. Okay, so teeth will also fall out, so that is why you have to give some soft food, easy to chew food. Okay, gastric function, there is a decreased secretion of hydrochloric acid, peptic acids, pancreatic hormones, juices, etc. Then small intestine, there is a, the pH level of the small intestine gets altered, and that is the reason why even if their food has adequate nutrients, that the absorption level is also reduced. Okay, in the elderly, because the pH level of the small intestine, the pH level of the gut alters over the period of time. And liver and biliary function, they are if they are alcoholic, they are more prone to get liver cirrhosis, or any fatty liver, non-alcoholic fatty liver, alcoholic fatty liver. Okay, such kind of diseases, especially if they have the issue of alcoholism, this gets worsened. Okay, the risk factor of getting liver related diseases, gallbladder stones, etc., it gets worsened, the risk increases. Then metabolic function, overall metabolism is quite low, not just for certain nutrients, but for the entire overall, even the basal metabolic rate, the resting metabolic rate, even when you are, what the cause of non-alcoholic fatty liver is one main thing. If you have seen, the children who are born with jaundice, okay, um, as soon as a child is born, okay, we give them phototherapy. Okay, that we'll discuss when we'll discuss about nutritional requirement of infants and all in detail. We'll see that. So we have seen that studies have shown that the children who have suffered jaundice at the birth, during birth, okay, as soon as they were born, they had to be given phototherapy, etc. And they grow up, and it has been seen that even if they do not consume alcohol, they tend to get, they have a high risk of acquiring non-alcoholic fatty liver. Even if they are not consuming any alcohol, there will be fatty deposits over their liver. And previous history of jaundice, chronic jaundice, anyone, not just children, even in their childhood, the teenage or early adulthood, they had jaundice, and it was quite chronic. That will also lead to the risk of non-alcoholic fatty liver. And then there is other predisposing factors like family history, etc. Okay, and also diet which is heavily rich in fat. Okay, heavily rich in fat is a very those people have high chance of getting non-alcoholic fatty liver. Okay, especially the young adults who frequently have food outside and have a lot of junk food, especially which is doused in a lot of fat, they have a tendency to get non-alcoholic fatty liver. Ideal pH of the body we have discussed in a chapter. Okay, I think it was in carbohydrates, where different pH level in the gut, in the stomach, the small intestine, everything was discussed. Okay, and it can be a side effect to certain medications also, but it's side effect of medication causing non-alcoholic fatty liver is quite rare. Then you have neurological function, confusion state, and we'll discuss about other neurological diseases at the last, like Alzheimer's, Parkinson's, etc. So neurological state becomes quite altered because of old age. Immunity also goes down. Antioxidants, zinc, other minerals has to be increased in their diet. Ophthalmic, for symptoms managing non-alcoholic fatty liver and all, please refer to Dr. Pawan Mittal. He will guide you with that. Ophthalmic, obviously we know the vision decreases. Okay, the visual acuity decreases over a period of time. And on top of that, if you are deficient in vitamin A, beta carotenoids, vitamin A, your diet is deficient in omega-3 fatty acids, especially these two things, vitamin A and omega-3 fatty acids. If your diet is very much deficient in these two vitamins, you will get some or the other kind of ophthalmic damages. Okay, macular degeneration, cataract, such ophthalmic damages very soon. Okay, even before you hit your old age, that is 60. Old age is certainly the age of retirement. Okay, we can consider the age of retirement as an example for old age. So before that, you may get such disorders. Also, if you have underlying diseases, if anyone has an underlying diseases like diabetes, hypertension, their risk of getting macular degeneration, degenerative diseases, cataract increases. Okay, other cardiovascular diseases with old age, your risk increases. So automatically you have to reduce what kind of food if you have a risk of cardiovascular diseases. Anyone can answer in the chat box what kind of food you have to restrict or reduce. To prevent cardiovascular diseases in old age. Yeah, high cholesterol rich, basically to control the intake of fat, but polyunsaturated fat you can take. Okay, omega-3 fatty acids, omega-6 fatty acids you can take. Monosaturated fats you can take. We don't get confused about all these different types of fat. We will discuss when we will discuss about the chapter called lipids. Okay, in nutrition, in the subject of nutritional science, we'll discuss about all these different types of saturated, non-saturated, polysaturated fats in detail. So you will be clear in that. So polyunsaturated fats or like omega-3 fatty acids and mono unsaturated fats, they are best. They are good for the health, for the cardiac health in general. But other trans fat and other kind of fats are not that good. So what are the examples of all these different types of fats? We'll discuss in the chapter called lipids. Okay. Yeah, VDL is quite bad. Then renal, your kidney, okay, the filtration rate of your kidney, the glomerular filtration rate over a period of time, it decreases. And too much of protein, we require protein, the elderly also requires protein, somewhat to the similar amount as what an adult man would require, but over intake of protein may affect the health of the kidney. Okay, so to digest, to filter out the protein will get very difficult for the glomerular capsule of the kidneys and the nephrons. So to restrict protein to an extent that there is no skeletal damage, but also there is no renal damage. Okay, so toxicity level and overconsumption of protein has to be given a special attention to. Okay, minimum requirement has to be followed, but do not overconsume of protein when you are dealing with the elderly. Do not let them overconsume anything that is protein rich, that may invariantly affect their health of the kidneys. So now coming to the nutritional requirement, it is a general basic guidelines what you may have to follow while taking care of a elderly person. Okay, so like energy, carbohydrates. Okay, we will just briefly go through how and what you have to do. So it is said that the basal metabolic rate and the resting metabolic rate. Resting means even when you are sitting, okay, where you are not doing anything, your body is still digesting stuff which you have had. Okay, so that resting metabolism rate drastically reduces as you grow old, especially after the age of 35. Okay, after the age of 30 to 35, if you are having a sedentary lifestyle, after the age of 30, it will reduce. If it is a moderate to heavy workout lifestyle, after 35, it will drastically reduce your basal resting metabolic rate. Okay, so it is said that um, protein level, the body protein level of the elderly is around 30 to 40% less. Automatically it reduces that, it goes to that variation. Okay, 30 to 40% less than a normal healthy adult. Okay, you can take the reference Indian male as an example for that. So and but the protein level decreases, but the opposite takes place in case of fat. Okay, so earlier when fat was supposed to be just 15% of the uh, average body fat percentage, it was just 15%, but as you grow old it becomes 25%. Okay, there is an increase by 10%. So your protein decreases and the fat stores increases in old age, so you are more prone to get to be obese if calories are not counted and if calories are not controlled. Okay, so that you have to keep in mind. So energy, about the energy, there is a table 10.2. Okay, according to the ICMR guidelines for males, females, and males and females who are sedentary, moderate working, okay, heavy workout in different ages. Okay, from different ages, like from 18 to 30, 30 to 60, and above 60, and also at different weight, at different body weight, what is the energy requirement. Okay, total a day's energy requirement, what is the calorie requirement, it is given clearly in the table 10.2. You can use this table as a reference table when you're giving some nutritional guidance or dietitian guidance to your consumers and customers. Okay, so this is a very good table. It is on page number 10.2. Males, females, and different segment when they are in different segment of their lifespan, from the age of 18 to above 60. It has been given, very classified information is given, so you can refer this table for practical reasons. Okay, so it is said that after the age of 35, the basal metabolic rate decreases. Okay, and because of this reduced muscle mass, their strength also decreases, their muscular strength decreases, and the energy requirement automatically, if your muscle mass decreases, the energy requirement will also decrease after the age of 30. And if you do not know that okay, I'm growing about, I'm about 30, my energy requirement is not that much as how it was 5 years ago, and you do not constrain your intake of nutrients, you may lead to certain obesity issues or other nutritional issues. Okay, so that kind of guidance has to be given to your customers as soon as they go beyond the age of 30 to 35. Inform them that their energy requirement is quite less as compared to their early adulthood life. So to be restrictive in especially in the excessive intake and overindulgence on calories. Okay, so that kind of advice you can give here. Then carbohydrate, the daily requirement, whatever is the total calorie. Okay, for example, males at the age of 60. Okay, if somebody, if there is a male at the age of 60 and he is a sedentary worker, okay, office going worker, routine worker, not having enough physical activity, so their calorie requirement is just 2318 calories per day, and out of this 50% of it, almost like 1000 to 1200 calories, kilocalories. You can keep that much of calories. It should come from carbohydrates. The remaining should come from fats, proteins, etc. You have to calculate like that. Okay. Protein, again, 1 kg, 1 gram per kg body weight. Whatever is the weight of the person. For example, this weight of this man was 60 kg, so 60 gram of protein per day has to go into their diet. Okay, and depending upon their age also, if it is an early adult, if somebody is in 18 to 30 years of age, 2 grams per kg body weight, 3 grams per kg body weight, they can take, they can handle it, their kidneys can handle it. But as they are growing old, above 50, above 60, do not increase this protein intake beyond 2 grams. Okay, at least minimum 1 gram per kg body weight has to be maintained. Don't go below that, but also don't go beyond 2 grams per kg body weight, because it will negatively affect the health of their kidneys. And lipids, again, make sure that the elderly consume enough amount of omega-3 fatty acid. If they are a non-vegetarian, you can guide them to reduce the intake of white meats like chicken, okay, and red meats, and instead choose having fish. Okay, having fish is a very good source of omega-3 fatty acid. And of course, if they are a vegetarian, compulsorily, even for females, compulsorily, non-vegetarian or vegetarian, every day flaxseed has to be consumed. Okay, it is given in the textbook. Female, especially, omega-3 fatty acid in the form of flax seeds, it has to be consumed, because it helps, flax seeds also helps in regulating your post menopausal symptoms, etc. And even when you're reaching menopause, there are like symptoms like hot flushes, irritability, mood swings, okay, drastic mood swings, etc. And some women also face depression and other psychological issues when they approach menopause. So these symptoms can be elevated. Okay, these symptoms can be completely elevated if you have a good intake of omega-3 fatty acids. Okay. About specific disease conditions like renal agenesis and all, we will talk about that when we'll discuss about nephrology, diet in kidney diseases, etc. Okay, this is in general. There are different chapters for different body systems and their disorders. In that, we will talk about what kind of diet has to be given. Always remember, if your diet is able to supplement enough amount of nutrients, do not be for a healthy individual, I'm speaking. Okay, do not be dependent on nutritional supplements when you know your diet can give the same. Okay, for your first source of nutritional supplement should come from the diet. and other kind of synthetic supplements should be a secondary option when you are in that kind of acute deficient stage. Then we have minerals like calcium, zinc, iron. Okay, very much important, especially calcium. Can anyone say why calcium is important in old age? Not just for women, but also for men. Yeah, for bone health. Even after a certain age, for example, after 50, even the man's body will react in the same way how a female's body is reacting. Okay, the calcium stores get depreciated over a period of time, even in a male's body. Okay, so that will lead to porous bones, okay, prone to fractures, tooth decay. Okay, that kind of issues may come. That is why calcium is very much emphasized. Either drink milk, and for women it is always recommended to have nutritional supplement along with dietary supplement, because you for calcium it is very difficult to find good sources of calcium apart from milk. Okay, calcium in the body will cause kidney stones and other vascular diseases. So there is a limitation to that, 800 mg, 800 mg of calcium. And iron is required because when we talk about elderly, always assume that they may have some or the other underlying disorders. Okay, some inflammatory disorders like colitis. Okay, any inflammatory disorders, that inflammatory disorders is leading to some kind of blood loss within the body. Okay, and when we are talking about women, we know naturally a huge chunk of the Indian women, okay, especially Indian women, are anemic, especially iron deficiency anemia. They are facing iron deficiency anemia in our India, especially in Indian women. Okay, so in that case, iron is very important, not just for women, but also for elderly males, because of any underlying blood work for any test for nutrient in the body. What is a, if you're toxic, if you're in a toxicity level, or if you're in a deficiency level, blood work has to be done. So iron is required in a very important essential uh, factor for women as well as for males. Okay, for why for males? Because certain underlying diseases, underlying inflammatory diseases will lead to deficiency in iron, and that will lead to anemia. And on top of that, with age, we have discussed this earlier also, iron is very tricky mineral to be easily absorbed. Okay, on top of that, your GI system, when it is undergoing aging process, naturally the absorption rate also comes down. So iron has no iron, especially from food, it has near to zero chance of getting absorbed. So that is why main focus has to be provided on what is the transferrin levels in the blood, etc. And zinc, immunity, zinc will help in the immunity. We know that with old age the immunity goes down, especially the cell mediated immunity, etc., it goes down. So that is why zinc has to be zinc supplement has to be emphasized. Vitamin C will help, but the daily requirement of vitamin C, you can very easily get it through fruits and vegetables, raw fruits and vegetables. That is why we say vitamin C supplements you do not have to take. If you can get your hands onto fresh fruits and vegetables, green leafy vegetables, okay, which is all throughout the year. It is in India being a very tropical country, throughout the year we can get our hands onto fruits and vegetables at a very cost effective rate, and our vitamin C needs, okay, can be met completely through the fruits and vegetables which we have. So because of that reason, we do not have to depend on vitamin C supplements too much. If you are someone who doesn't like fruits and your diet is something very restrictive, or you have other reasons for a certain personal reason, and in that case you are deficient in vitamin C, then you may have to take vitamin C tablets. But for a healthy individual, a healthy balanced diet will give you sufficient amount of vitamin C. Okay, but these are the minerals that are very tricky and not easily available, and even if it is available, it is not easily absorbed in the body. That is why or elderly may have to resort to these nutritional supplements. Then coming to vitamins, vitamin D, again for the bone health, vitamin D is important. And if usually elderly people are not someone whom you will find completely 24/7 outside. Okay, they are after the age of retirement, mostly they will be in the indoors. They are not exposed to too much of sun. Okay, so that is another reason why they may go into the vitamin D deficiencies. So ideally pharmacological nutritional treatment is given for 50,000 international units of vitamin D. There are 2 to 3 derivatives of vitamin D which is given. First, they will start an intensive treatment with vitamin D3, another one derivative vitamin D, 50,000 international unit of vitamin D3 for 8 weeks. And after that, they will shift to vitamin D2. Okay, so like that, that is the usual protocol mentioned in the textbook. I think so. In practice, also commonly they will use that. Weekly, 1 dose of vitamin D is taken either orally, or they can mix it with in powder form also it is available. You can mix it with the warm milk and then consume it. Then vitamin D, it is vitamin E. It is very good for the immunity. Okay, 200 mg of vitamin E can be taken, and it will help the body to be protected against the DNA damage because of any ultraviolet radiation, UV rays, or any other oxidative stress which can damage your DNA. So vitamin E can protect you against that. So at least 200 mg of vitamin E on a daily basis. Then you have vitamin K. You can get a good amount of vitamin K just by consuming good amount of green leafy vegetables. Okay. Then vitamin B vitamins. First, you have to make a note that the elderly, is he or she alcoholic or not, because anyone who is alcoholic will automatically have vitamin B12 deficiency. Okay, especially the folate vitamin deficiency will be seen in alcoholics. Okay, so first you have to make sure you have to rule that out if it is alcoholic or not, he or she is alcoholic or not. And if they're not alcoholic, you can give them dietary guidance on which kind of millets, pulses, and cereals to use. They are a very good source of vitamin B12, B complex vitamins. Okay, pulses, cereals, all the millets, etc. And if you are treating someone who's a known alcoholic, you have to supplement with B complex nutritional supplements. Okay. And vitamin C, as I told earlier, if you take a good intake of fruits and vegetables on a daily basis, you will not have to depend on external supplements. Okay, as much as possible, wherever you can reduce the nutritional supplements, that you have to do, especially in the case of elderly, because the way how the liver is going to metabolize these byproducts of nutritional supplement is not going to be the same in case of elderly. Okay, so their liver functions are also quite slow. So the way how these nutritional supplements will be absorbed, stored, and then converted into derivatives for physiological use will be at a very slow rate. So we have to keep that in mind. Just because they are deficiently, directly you can't prescribe them with nutritional supplement, because you have to see what all medications is already going on for the elderly, and will their liver will the liver will be able to tolerate the additional supplement of nutritional supplement or any other pharmacological drug or not. So that has to be taken care of. Then water, minimum 2 liter has to be consumed. In the textbook they have given 1.5, but to maintain a good level, a minimum 2 liter of water should be consumed by the elderly. And there is another reason for that. Have you heard of urinary incontinence? Okay, can anyone say what is urinary incontinence? I guess people from the medical background will have an idea of that. Urinary incontinence. Yeah, not able to control the urine. When if they feel like urinating, they will have no control over their bladder. Okay, usually it is the bladder is out of control, or the urethra is not in the voluntary control. Okay, so just imagine what will be the psychological factor which will be affecting an individual who has urinary incontinence. When they hear something, they have to drink liquid, okay, and they have to go to a social function, they have to be outdoor, they are not in the house, they are outdoor somewhere, and they may have to drink water or any kind of fluid. Will they happily have it, or they will try to avoid it? They will not drink. That is the usual case, okay. And urinary incontinence is a very common thing which we see among the elderly. So because of this psychological factor, they tend to stay away from anything fluid in general, and they can go for very long hours without consuming water, and they do not know they are putting their body into the stress of dehydration. Okay, so that is why urinary continence has to be treated. There is other treatment measures for that, but water intake has to be maintained. Okay, so and another reason is there, that with the passing age, a person's thirst mechanism is also altered. They do not realize they are thirsty or not. Okay, so until and unless you give them the water, they do not remember to have water, and they do not feel the sensation of thirst as how an adult, a healthy adult or younger people would um, but have a perception of thirst. Okay, the perception of their thirst decreases over the period of time. So that is why they are very much prone to dehydration. Then fiber, we have discussed in detail about fiber, how it helps. Okay, various nutritional benefits of fiber. So are old age people, okay, are they prone to constipation or not? In the chat box, constipation or any GI related disorders. Yes, they are. So the fiber, not just giving them soft diet, but giving soft diet along with that, giving them enough fiber, not too much of fiber, because too much of fiber will not allow the intestines to absorb the nutrients. Okay, too much of fiber will not allow the intestine to absorb nutrients. So not more than 60 gram, okay, at least 60 gram, but not more than 60 gram of fiber in the entire day's diet. Okay, so fiber will help them in peristalsis movement. Okay, peristalsis movement is it starts when you eat food. Okay, it starts at your mouth, it will end at the anus when you defecate. Okay, so peristalsis movement is a wave like movement of the entire GI tract. Okay, we'll discuss about that when we will talk about the diet in gastrointestinal diseases. Okay, I will show you the image of how peristalsis works. When the for example, if this is the esophagus, when the food reaches here, it spreads and it pushes the food forward. Okay, the muscles will contract and relax. So that contraction and relaxation will make sure that the food, the bolus, is pushed forward. Okay, so that is what we call it as peristalsis. Okay, peristalsis movement, it starts when you start chewing. Okay, when the mouth gets food, it starts chewing, the peristalsis movement will start. Okay, and to increase the peristaltic movement, if your peristaltic movement is very slow, those are the people who will suffer from constipation. Okay, a simple thing to make sure that your peristaltic movement is adequate enough is to have lukewarm water whenever possible. Whenever you're drinking water, instead of having chilled water or cold water, try having lukewarm water. Okay, lukewarm to hot water. Okay, so, sip lukewarm water instead of chilled water. That will aid in a very good peristaltic movement, and that will make sure that the individual doesn't suffer from constipation. Okay, so fiber will stimulate the peristaltic, and not just walking, any physical activity can help the peristaltic movement. Okay, so yeah, fiber will help with the peristaltic movement. It also prevents certain colon cancers and any cancers related to the GI tract to an extent. Other factors are also involved. Don't just be dependent on fiber. Okay, other factors are also involved to prevent cancers. And when you're giving them fresh fruits and vegetables, try to give them tender fruits and vegetables which are like recently they have been procured by the procured, and they are not old vegetables. Okay, don't give them old vegetables. The fibers in the old vegetables will be very difficult for their body to work with. Okay. Then we have antioxidants. Very less information is to be shared about this. Okay, antioxidants. We have an entire chapter for that in nutritional science. Okay, but just touching through the antioxidants, you can tell me how it is going to help. Okay, remember this thing: oxidative stress and free radicals, and you can give the answers in the chat box. How antioxidant is going to help an elderly? Anyone in the chat box? Different types of antioxidants you get from vitamin E, vitamin C, foods that are rich in vitamin E, vitamin C, vitamin K, okay, beta carotenoids. Yeah, helps to remove the free radicals. Free radicals are the byproducts of any reaction, molecular reaction which is taking place inside our body. There is some byproduct or some toxin, okay, which is a byproduct. It has to be drained out of the body, okay, at any cost. If it stays in the body, it will cause oxidative stress to the cells, and that will accelerate the process of aging. Okay, prevent tissue damage, very important. Reduce the effect of oxidative stress caused by free radicals. Yes. Help control inflammation too. Yes, it will help in inflammation. Wound healing. In old age, it is very important to have food that will help in wound healing, especially if somebody is diabetic. Okay, having food which can aid in wound healing, vitamin C rich foods especially, and vitamin E rich food. Vitamin E, vitamin K, and vitamin C. Foods rich in all these three vitamins will help in wound healing. Yeah, free radicals action in detail. It's a very complex action, okay, because of oxidative stress. When we'll discuss about the antioxidant chapter, I'll discuss it in detail, because if I just say, people who are from the commerce background, they will not understand certain medical terminology which we will use here. Okay, so for that, proper images and animations are required to make sure everyone gets it. Okay. Yeah, so that's how antioxidants will help, basically to keep cancers at a bay, okay, to prevent cancers to an extent. Okay, cancer will not take place just because of one thing that has gone wrong. There are several other environmental factors coming together. Okay, so keeping cancers at a bay, keeping inflammatory diseases, preventing inflammatory diseases. Okay, reducing the aging process. You can't delay. You can definitely delay the aging process, but you can't prevent the aging process. Okay, so delaying the aging process to an extent, making sure all the tissues are healthy, physiological functions are going well. That's how antioxidant will help. So food requirement for the elderly: it should be soft and easily chewable food, because they may be using dentures and some of the teeth may be already fallen off. So soft and easily chewable food. Easily digestible food, because there is a decreased production of digestive enzymes and digestive juices. Fat restricted, but polyunsaturated fats can be included. PUFA means polyunsaturated fat. That we will discuss about in detail when we discuss the lipid chapter. Okay, what are the different examples of PUFA? Okay, MUFA, that is monounsaturated fatty acids, etc. Fiber rich food to prevent constipation and other cholesterol related diseases and colon related diseases. Restrict caffeine, because it will keep them up in the night. It will give them insomnia, etc. So reduce caffeine, like controlling the intake of tea and coffee. We can limit that. Liberal use of green leafy vegetables. It will give all the vitamin C, vitamin E, vitamin K, everything that is required, antioxidant rich. Okay, if every day they are having a good healthy dose of green leafy vegetables in their diet, it's well and good for their overall health. Familiar food, like for example, youngsters can try new food. Okay, they are in the age of trying new things, but People who are elderly, they prefer familiar food which they are used to, especially their staple food, etc. So that has a psychological belongingness also to that. Clear soup, always start the food with clear soup. Small and frequent meals, which disorder it will help a lot? Can anyone say in the chat box which common disorder, disease which we see among the elderly? Okay, which is that common diseases in which small and frequent meals will help a lot? Yes, diabetes. Okay, especially type 2 diabetes. Having small and frequent meals will help a lot. Now the cases are very high because it is a lifestyle related diseases. It is very high. Warm milk before bed, because milk is a warm milk, not the cold milk. Warm milk is a natural relaxant. Okay, it will make sure the adrenaline is not released in the body, because if your body is continuously pumping adrenaline, you will not sleep properly. Okay, so it will reduce the release of adrenaline. So warm milk is a natural relaxant, so giving warm milk before they go to bed, it will make sure that they have a good sleep. Having turmeric and everything with milk is optional. Okay, they say it is good, but at least if it is a warm milk, it serves the purpose. Heavy meals at noon, prevent having heavy breakfast and heavy meals at night. At noon you can give them heavy meals. Light meal at night. Avoid too many sweets because it can lead to dental caries and too many fermentation, flatulence issues, gastric issues. Plenty of fluids. They are very prone to dehydration, as we discussed earlier. Consume flax seeds, especially women, because it will help in treating the postmenopausal and premenopausal symptoms. Now discussing the nutritional problems, the common nutritional problems which you see among the elderly. First is osteoporosis. There is a spelling mistake here. That is just one P. Okay, so don't mind that. Osteoporosis. Always remember, in an individual's lifespan, when they are in the age between 25 years of age to 30 years of age. Okay, when you know someone or you are in that age, that is the peak bone mass age of your life, of your entire life. After that, the bone mass will naturally decrease. Okay, so yeah, at the last I will show you the slide which you want to see. Okay, so always remember, 25 to 30 is the age when your bone mass is at the peak. After that, it's a declining slope for women as well as for men. So calcium intake and vitamin D up till the age of 30 has we can't stress more on that information. Having vitamin D as well as calcium, especially in this 25 to 30 years of age, so that you can prepare your body well to see how your bones are going to react in the old age. Because after a certain age, as I told earlier, the absorption of calcium decreases. Okay, how strong your bones are already made in the age of 30, by the age of 30, can delay the osteoporosis and other bone related disorders to an extent. Okay, so that we have to keep in mind. There are a number of symptoms, signs and symptoms, images given in the textbook. You can just read through that. Okay, so risk factors about osteoporosis. Who are at risk of getting osteoporosis too soon? Okay, first, all the population who are in the elderly group. Alcoholism, those who are alcoholic. Chronic steroid use. It's seen in people with cardiovascular diseases from a very young age. Also, those who are into too much of bodybuilding and that kind of entertainment industry related jobs. Okay, too much of steroid use can cause osteoporosis, early osteoporosis. Females are more prone to osteoporosis than males. Then we have rheumatoid arthritis, those who have the family history of arthritis. Okay, they have to be very conscious about it. Thin body, malnourished body. And surgical removal of ovaries or testes because of any ovarian cancer or any other reproductive issues, you have to surgically remove the ovaries and testes, because ovaries do secrete the estrogen, and estrogen to an extent will delay the osteoporosis. To an extent, estrogen, the hormone which is being secreted in the female body, to an extent estrogen helps to delay the osteoporosis. So, and vitamin D deficiency, people who are vitamin D deficient, automatically they can acquire osteoporosis soon. Uh, Thyroid issues, diabetes type 1, both type 1 and type 2 both, and sedentary lifestyle. There is no zero to no physical activity. They are prone to getting osteoporosis. So yeah, various risk is given in table 10.5. Just read that. You will understand who are at an early risk of getting osteoporosis. Then we have obesity, as discussed earlier. The protein, the lean mass level comes down drastically in old age, but their fat stores, okay, it increases from 15 to 25 percentage. So naturally, your body is getting ready to acquire more fat, and if you give them more, if you give the body more calories, excess carbohydrates will be converted into fat, and it will be stored in the body. Okay, that is how elderly are more prone to obesity. Okay, and also with age your physical activity reduces, but if your calorie intake is not reduced, it will lead to obesity. Okay, then we have anemia. There are different reasons for anemia. For females, it is heavy menstruation, etc., and diet which is deficient in iron. And for males, it is any chronic inflammatory diseases which is underlying that can lead to anemia. So making sure that iron consumption is adequate, if not from the diet, at least through nutrition supplement, iron consumption is adequate. Then you have malnutrition in general. There are various social factors also related to malnutrition, because elderly segment of the population is somewhat more neglected as compared to other segments of the population. Okay, elderly feel social isolation very much as compared to others. Okay, their needs, their nutritional needs are often neglected. Okay, say also there is a social factor which is going on, that now we are becoming more and more of a nuclear family nation than a joint family nation, and that is the reason why there is a social exclusion of the needs of elderly people. On top of that, India is a young country, so most of our healthcare and every policies, okay, from the central government, state policy, it is mostly focused on young India rather than on the old age people, because old age, as of now when we speak, the old population, they make up only around 10 to 12% of the entire Indian population. Okay, so that is also another reason they are systematically neglected, that means are systematically neglected. Okay, so that will also lead to malnutrition, and or they do not have enough information of what they should be having, how their diet should be. Okay, nobody is there to help them out. And other reasons, like with n number of underlying diseases, their appetite will be reduced, and with a reduced appetite they will not be having a proper good balanced diet. So there are n number of reasons why malnutrition can take place for an elderly. Then we have constipation, if their diet is not fiber rich, and on top of that they have a very reduced peristaltic movement. Obviously when you grow old, the peristalsis reduces. Okay, the waves of the peristalsis, it reduces. The frequency and the strength with which your GI muscles can contract and relax, okay, that strength reduces. Okay, the stool means the feces will stay in the GI tract for a very long time, and the longer it stays, the stool, the feces, the longer it stays in the large intestine, the harder it gets. So that is what we call it as constipation. Okay, then immunity declines. We have seen that, we have discussed on that, the immunity declines for elderly, the way how their cell mediated immunity, okay, everything, they are more prone to bacterial infections, because the basic barrier immunity which your body has, like your saliva, the mucous membrane. Okay, automatically these cells which produce mucus, okay, the salivary glands, other glandular level secretions, everything will decrease over a period of time when these enzymes. um, yeah, diet, if it is a fiber rich diet for adults, that is more than enough. And having lukewarm water every time when you have food, or even if you're just drinking water, having lukewarm water, that can really help out adults for with constipation. So when your barrier immunity decreases, automatically the body is more prone to outside infection. Okay, so that is one of the reasons. Then dehydration, as discussed earlier, thirst mechanism is altered in old age. On top of that, when there is other underlying diseases like kidney related diseases, nephrological diseases, and urinary incontinence and all, people stay averted, they have an aversive feeling towards fluid and other liquids, so automatically they go into the state of dehydration. And also neglecting the needs of elderly, that can also lead to dehydration. Alcoholism, the risk of malnourishment and deficiency is 2 to 3 times when a person is alcoholic, especially B complex deficiency. Degenerative diseases, first one is the cardiovascular diseases. What all degenerative diseases we are going to discuss now. Remember that oxidative stress is the main causative agent for all the degenerative diseases which we are going to discuss. Okay, starting with cardiovascular diseases, blood pressure continues to increase in women even after the age of 80, but for men after the age of 80 the blood pressure comes down. Okay, they are not prone to hypertension after the age of 80, men, but women even after the age of 80 the blood pressure still increases. So making sure that you have antioxidant rich food. Okay, the answer to all the degenerative diseases is antioxidant rich food. Okay, so making sure that you have good antioxidant rich food will make sure that your blood vessels do not accumulate the damage of free radicals in form of plaque. Okay, plaque means is the deposits of cholesterol and all that will reduce the blood flow. Okay, and the free radicals have a role to play in that. These free radicals can directly damage the musculature of your vascular system also. Okay, when the muscles of the vascular system is weak, automatically they will not be contracting with the same vigility with which they should be contracting. And when they are not contracting enough, the fat deposits will not move forward. They will sit in one place and they get stuck on each other, and they will form the plaque, and that will lead to cholesterol, atherosclerosis, etc. Okay, so that is how cardiovascular diseases will come into existence. Then renal diseases, make sure protein rich diet is restricted. Okay, the diet should have enough protein but not too much, that will cause an ill effect on the glomerular level. Okay, and it will lead to glomerular nephritis, etc. For alcoholism, the first main thing is have them rehabilitated. Okay, yeah, for renal, when the diet has too much of proteins, okay, the blood will carry that protein to the kidney for filtration, and when these proteins get stuck in the cellular level, that is the nephrons. Okay, nephrons is the structural and functional unit of the kidney. Nephrons, it's a cell. This cell has different parts like Bowman's capsule, glomerular filtration, okay, everything. So these proteins will get stuck in the filter, in the natural filter which we have in our nephron. Okay, and that will cause inflammation. Being stuck there, anything that is stuck in the nephrons, okay, that will stay there and cause inflammation. Okay, and that's how we get inflammatory renal disorders like glomerular nephritis, etc. Okay, so that is why we should not overload the elderly people's diet with protein. Okay, only 10 to 15% of their calories should come from protein. 50% can come from carbohydrates, 8 to 10 can come from fat, and the remaining can come from the roughages and fibers, etc. Okay, like that we have to plan. Then cataract, macular degenerative diseases. Those are very common. If the diet is rich in omega-3 fatty acids, if the diet is rich in antioxidants, okay, omega-3 fatty, especially omega-3 fatty acids, it has been, studies have shown that people who have a good consumption of omega-3 fatty acids, that is either via flax seeds or other nuts and berries, or other like fish, cod liver oil, or fish, having fish, the meat of fish, okay, in that case we have seen that they do not develop degenerative eye disorders. Okay, their visual acuity stays stays healthy quite longer in their life, up to a good ripe old age. Their visual acuity is quite good. So that we have seen. So that is the importance of omega-3 fatty acids. Then cancer, having antioxidant rich food, okay, to prevent colon cancer, etc., have fiber rich food. So antioxidants have proven that certain cancers can be delayed or prevented to an extent, okay. But if you have other environmental external factors that can cause some damage at the DNA level, that is very difficult to reciprocate with. Okay. Am I audible now? I guess the internet connection is quite weak. Am I audible to all? Is the slides clear to all? Is the slide breaking, or is the screen breaking? At least is the slide clear to all? The slides. Okay. So I guess till it was clear. For cancer, remember that people who have high antioxidant intake are less likely to develop any cancer to an extent. Okay, but if there is damage to the at the DNA level, that has to be treated accordingly. Okay, and changes to skin, automatically we know that as we get older, our collagen, okay, our collagen, the fibrous network that keeps our skin plump and healthy, the elastins, which helps that when you pull your skin and you leave the skin, it goes back to its normal position. That is because of elastins. So collagens and elastins both will decrease in size and numbers over a period of time. So that is why the skin get wrinkly over a period of time. Okay, and on top of that, wound healing, if your body doesn't have proper collagen supply, okay, or proper strong collagen network, when you get a wound, it heals in a delayed way. Okay, and also in elderly, wound healing is quite delayed. So but antioxidants have proven that it makes sure the collagen stays intact and plump for the longest time, and aging can be certainly delayed if the skin has a good antioxidant supply through diet as well as certain topical applications too. Then we have Alzheimer's. You can see the image here. In Alzheimer's, usually people tend to forget things, quite common in old age, the disorder of Alzheimer. How diet is influencing Alzheimer is that there are certain deficiencies like folic acid deficiency, and on top of that, if a person is having high caloric diet, okay, high caloric diet, obesity, etc., okay, those people have a higher risk of developing Alzheimer's in the old age. And it has been seen that people who eat Mediterranean diet, like diet which is food which is rich in fruits, vegetables, olive oil, red meat, and all, in those people the risk of Alzheimer is quite low. Okay, Mediterranean diet is usually the Greek food, the Greek cuisine, okay, that can come under the Mediterranean diet. So the people from that part of the world, we have seen a very low rate of incidence of Alzheimer's and Parkinson's. Okay, so these are the various different symptoms of Alzheimer's: confusion with time and location, difficulty in completing day-to-day task or familiar task, difficulty in solving problems, okay, misplacing items, memory loss, unfounded emotions, poor judgment, difficulty with words, forgetting people's name, forgetting their own family members' name, and unable to identify their family member just by looking at their face. Okay, that kind of symptoms you will see. Withdrawal from social activity. So that's Alzheimer's. And in Parkinson's, it's a neurological disorder. Okay, so because of the synapses means where two neurons try to connect and send messages. There is some disorder that is taking place there when the neurons are not able to convey the message forward. So that is a reason why a person gets Parkinson's disease. And these are the different symptoms of Parkinson's disease. Rigidity, the body is quite stiff and it has a continuous tremorous motion. Okay. All foods that is rich in fruits and vegetables, and try to use olive oil if you want to incorporate some Mediterranean kind of cooking. Don't overcook the food. Cook the food in olive oil. Incorporate a lot of fish. Okay, fish meat and red meat, to an extent red wine, etc. But usually, say in the geographical and social geographical preferences in Indian food, it is quite difficult to incorporate Mediterranean diet other than using olive oil, fruits and vegetables. Okay. If you see the non-veg aspect to it, it will be quite difficult for the Indian population to adapt to a Mediterranean diet. So yeah, these are the different signs and symptoms for Parkinson's disease. And bradykinesia means they do not have much control over their movements. So it's when they try to walk, it is on a very slow pace. Okay, just try to see certain videos for the symptoms for Parkinson's disease using Google or YouTube. You can understand how the symptoms are visually. Okay, tremors are there. They're like shivering and shakiness in the hands. They're completely dependent on others for their, in the not in the initial stages, but in the final stages of Parkinson's disease, they are completely dependent on a caretaker. Then we have stress. Automatically, the people who are stressed, okay, who are constantly stressed, or they have n number of stress in their life, how do they look? Do they look cheerful, young, or do they look much older than their age? In the chat box you can reply. People who are affected too much with stress, they look older than their age, because stress causes oxidative effect on the oxidative damage to the cells. So automatically, that is the reason why people who are too much stressed about their jobs or any issues for that matter, they look quite older, because their cells and tissues has undergone a lot of oxidative damage just because of the effect of stress on their body. Okay. Yeah, poor skin and hair health also. So that's about the degenerative diseases. Then physical activity is there. You can just read it. Physical activity on page number 202 to 203. what points to remember, like always guide the elderly to warm up before they start brisk walking. At least 30 minutes of day-to-day physical activity is more than enough. Okay, so like that, some points are there, some components are there. You can do a self study on that. Just read that, understand it. Physical activity. Then coming to drugs and supplements, since there are a lot of underlying factors when it comes to elderly's health, okay, the diseases which they already have, etc., and the absorption rate of nutrients in their GI tract, okay, they are very much dependent on drugs and other nutritional supplements for their survival. Okay, so in the textbook they have given the aged community, the old age community, they constitute only 10% of our entire population. But the drugs they consume, okay, the pharmacological substances which they consume is over 25% of the produce. So you can understand how much is the consumption of pharmacological substances in form of drugs and supplements for this small segment of our population. Okay, what will be the impact of this level of consumption on their liver? Okay, so a lot of older adults, they are completely dependent on nutritional supplements, because the way how these pharmacological nutritional supplements are made, it is in such a way that even an elderly's GI tract, their small intestine, can easily absorb the nutrient. Okay, and it can do the physiological function it is supposed to do. Okay, so that is the reason why physicians usually prescribe the elderly people to into using nutritional supplements rather than depending on diet alone. Okay, this is a case where diet alone cannot satisfy the nutritional needs of a person because of certain other reasons, like the poor absorption ability of the GI tract. That is why we have to guide them to use nutritional supplements, especially for very essential nutrients. Am I audible now? Okay. So, in short, there are two things you have to take care when you are prescribing drugs and supplements for the elderly. See the health of their liver. Okay, that their liver function test is very common to be to make the elderly get done their liver function test, and accordingly we can give them the nutritional supplement that your physician has to do. Okay, the physicians who are capable of prescribing the nutritional supplements, they have to do.